Good morning, students. Today's topic of discussion is competency number 6.11 and subtopic is disorders of heme biosynthesis. They are also called as porphyrias. This word porphyrias are derived from porphyrins. Porphyrins means the intermediate compounds which are synthesized during heme synthesis pathway. So porphyrias may be defined as group of disease associated with error of metabolism in biosynthesis of heme. The Greek meaning of porphyria is purple color. Now these porphyrias are characterized by excretion of porphyrins, uroporphyrins, coproporphyrins, protoporphyrins, or their precursors like delta aminoleucinic acid, ALA, and PBG, that is porphobilinogen. Most of the porphyrias are autosomal dominant traits. Porphyrias are classified into three types depending upon the site where enzyme deficiency is seen. Enzymes of heme biosynthesis pathway are deficient. So depending upon the site of deficiency of enzyme, there is hepatic porphyrias where some of the enzymes of heme synthesis pathway are absent in liver. Erythropoietic porphyrias, that means enzymes of heme synthesis pathway may be absent in erythrocytes, or porphyrias with both erythropoietic and hepatic abnormalities where the enzymes are absent in both liver as well as in RBCs. One more classification of porphyrias is given, which is based on inheritance of porphyrias. Depending upon this, there are two types of porphyrias: congenital porphyrias and acquired porphyrias. Congenital porphyrias means they are present since birth, and these are usually due to deficiency of enzymes. And acquired porphyria means at the time of birth the heme synthesis pathway is normal, but during the lifetime, due to some deficiencies or due to some toxicities, the enzymes of heme biosynthesis pathway inhibited and heme synthesis is hampered. So such type of porphyrias are called as acquired porphyrias. Now we will detail study about these congenital and acquired porphyrias. The congenital porphyrias are 6 major types. First is acute intermittent porphyria. Next, congenital erythropoietic porphyria, Porphyria cutanea tarda, hereditary coproporphyria, Porphyria variegata, hereditary protoporphyria. So these are due to deficiency of various enzymes at various steps that we will see later on. And acquired porphyrias may be, just I have mentioned, due to some reasons like lead poisoning or any other heavy metal poisoning which inhibits some enzymes, chronic renal failure, malignancy, liver diseases, iron deficiency, because iron is required for the synthesis of heme. If iron is deficient, heme synthesis does not take place properly, which leads to porphyria. Alcoholism also leads to decreased heme synthesis and porphyria. So this is about the acquired porphyria. Now we will study in details about the congenital porphyrias one by one. So first is acute intermittent porphyria. It is a very important condition. It is a autosomal dominant trait. The enzyme deficiency is porphobilinogen deaminase, also called as uroporphyrinogen 1 synthase. Now this enzyme catalyzes the reaction in which the porphobilinogen 4 molecules condenses to form a linear tetrapyrrole structure called as hydroxymethylbilane. So in this pathway, it is seen at third step where porphobilinogen deaminase is deficient. Therefore, porphobilinogen is not converted into hydroxymethylbilane or uroporphyrinogen. So therefore, the two compounds, porphobilinogen and delta aminoleucinic acid, are accumulated in the blood, and as the heme synthesis is hampered, the concentration of heme in the body decreases. When the concentration of heme decreases, the enzyme ALA synthase activity is increased, because in the regulation of heme synthesis we have studied, when the concentration of heme increases, it causes negative feedback inhibition by repression and stop its own synthesis. So due to lack of end product, that is heme, the ALA synthase activity is increased. At the same time, just now I have told you levels of ALA and porphobilinogen PBG increases in the blood. No photosensitivity is seen. Photosensitivity is seen only when tetrapyrols are accumulated. This ALA and PBG are not tetrapyrol. PBG is a monopyrol. It is shown on the left side. This porphobilinogen, it is a monopyrol structure. And as there is no photosensitivity or no color pigments are accumulated in the body, so urine is colorless. Acute intermittent porphyria is the most common among the porphyrias. The patient have acute intermittent abdominal pain due to accumulation of ALA and PBG. This pain is relieved by carbohydrate intake, because again we have to recall the regulation of heme biosynthesis. At that time I have told you that glucose act as a inhibitor of ALA synthase enzyme. ALA synthase is the main enzyme of heme synthesis pathway. When that ALA is inhibited by glucose, heme synthesis stops. So here when you take carbohydrate, the glucose inhibit the ALA synthesis as well as PBG synthesis and relieve the pain. But starvation aggravates the pain. The opposite effect occurs in starvation, where the glucose is deficient and hence ALA is stimulated. ALA synthase is stimulated. ALA synthase is stimulated means it will synthesize more and more ALA and porphobilinogen. One more point about this acute intermittent porphyria is women have severe manifestations between menarche to menopause in this type of porphyria. This is because female sex hormones like estrogen and progesterone have stimulatory effect on ALA synthase. So the level of this enzyme is high between menarche to menopause. Before menarche and after menopause, the patient have less severe symptoms of acute intermittent porphyria. This acute intermittent porphyria is also characterized by neurological manifestations like sensory and motor disturbances, confusion, agitation. Some patients may present with psychiatric problems. The famous example is of King George III of England. It is said that he is also suffering from this type of porphyria. These symptoms, these above symptoms are common in patient taking drugs like barbiturate and anticonvulsants. Why? Because these drugs depletes the heme during their metabolism. When there is heme depletion, the feedback inhibition of ALA synthase is removed. Therefore, ALA synthesis is activated and it will synthesize more ALA and more PBG is accumulated, and which causes the aggravation of symptoms. Now this is a clinical case. 18-year female have psychiatric problems, so she was treated with tranquilizer. Drug given here is barbiturate. Immediately she develops acute abdominal pain and vomiting and admitted in the hospital. On detailed history, she was found to have taken tranquilizer in the past, but for the first time she develops the symptoms. Laboratory investigation shows high levels of ALA and porphobilinogen in the blood. So in this case, what is the diagnosis? Whenever you see acute abdominal pain and psychiatric problems, at the same time the level of ALA and porphobilinogen is high, the diagnosis is confirmed. It is a case of acute intermittent porphyria. Next question is, explain the biochemical basis of above disease. The patient is developing the symptoms after taking the tranquilizer barbiturate. Just now I have explained you, this barbiturate depletes the or utilizes the heme for its metabolism. Due to deficiency of heme, the negative feedback inhibition by heme on ALA synthase is removed. ALA synthase is stimulated and more porphobilinogen and ALA are synthesized and accumulated and aggravate the symptoms. Name the factors which precipitate the above disease. There are two factors in this case which precipitate the above disease. First is the drug barbiturate, and second is the age of the patient, that is 18 years. So this age is after menarche. So female sex hormones are high at the higher level at this age, and both these two factors stimulate the ALA synthase. Now how will you treat the abdominal pain? So this abdominal pain can be treated by intravenous glucose load and hematine. Just now I have explained you, when glucose is given, it have negative feedback on ALA synthase, or it will inhibit the ALA synthase. When ALA synthase is inhibited, the synthesis of ALA and porphobilinogen is decreased and symptoms are relieved. Now this hematine, how this hematine relieves the pain? During the regulation I have told you that hematine is nothing but it is the free heme in which ferrous iron is oxidized to ferric iron, that is called as hematine. Now hematine is a allosteric inhibitor of ALA synthase. So in diagrammatical representation of this mechanism is shown here. So hematine binds at the allosteric site of enzyme ALA synthase and brings the conformational change in the active site of the enzyme ALA synthase. Therefore substrate cannot bind there and the synthesis of ALA stops. So in this way the hematine will relieve the symptoms. Now the next type of porphyria is congenital erythropoietic porphyria. It is the only porphyria which is autosomal recessive. The enzyme deficiency seen in this case is uroporphyrinogen 3 synthase. Now this uroporphyrinogen 3 synthase convert the uroporphyrinogen 1 into uroporphyrinogen 3. If this step is hampered, then uroporphyrinogen 1 is accumulated. This uroporphyrinogen 1 undergoes decarboxylation with the help of enzyme EUPG decarboxylase and form coproporphyrinogen 1. So the level of coproporphyrinogen 1 is highly increased. Now this coproporphyrinogen, uroporphyrinogen and protoporphyrinogen, these are porphyrins. They are tetrapyrols. So they absorb light. They absorb light and then they emit light. Therefore photosensitivity is seen in this patient. Urine is colored due to presence of these porphyrins in the urine, and the color, name of the color given to the urine is port wine appearance due to presence of uroporphyrins and coproporphyrins in the urine. Now due to photosensitivity, these porphyrins absorbs light, and when they emit light, this light is used, emitted light is used for synthesis of reactive oxygen species or free radicals. Now when the concentration of these reactive oxygen species or free radicals inside the cell increases, they causes destruction of cells. Such repeated attacks are mainly seen in the skin because skin is directly exposed to the light. So patient is having repeated attack of dermatitis. Itis means inflammation and dermatitis means inflammation of skin, followed by ulceration of the skin, followed by scarring of the skin. So due to this process, the nose, ear and cartilages of face are damaged and the patient have suffering from a facial deformity often referred to as monkey face or leprosy face. So this is the most dreadful conditions. Some patients also shows erythrodontia. Erythrodontia means these porphyrins accumulated in the teeth, giving red fluorescence to the teeth on ultraviolet radiation. Now this is the case on this topic. A boy presented at clinic with disfigurement of face, staining of teeth and increased level of coproporphyrin 1. What is the probable diagnosis? When you see disfigurement of face and increased level of coproporphyrin 1, your diagnosis is confirmed. It is a case of congenital erythropoietic porphyria. Next question is, name the enzyme deficient. So the enzyme deficient is uroporphyrinogen 3 synthase. What is the biochemical basis of staining of teeth and disfigurement of face? This disfigurement of face is due to photosensitivity leading to repeated attacks of dermatitis, ulceration, scarring, which damage the nose, ear and cartilages of face, and staining of teeth is due to deposition of uroporphyrins and protoporphyrins in the teeth. Next type of porphyria is Porphyria cutanea tarda. Second most common type of porphyria. Incidence is 1 in 25,000. It is a autosomal dominant trait. The enzyme deficiency is UPG decarboxylase, which is the fourth enzyme. In this enzyme convert uroporphyrinogen 3 into coproporphyrinogen 3. So see this fourth step where uroporphyrinogen is converted into coproporphyrinogen by the enzyme UPG decarboxylase. When this step is hampered, uroporphyrinogen is accumulated in the body. Now this uroporphyrinogen 3 get converted into, or it is not converted, it is accumulated in the body, and as uroporphyrinogen 3 is also a tetrapyrrole, it absorbs light and have photosensitivity. Uroporphyrins are also excreted into the urine and urine is colored. This is less severe condition as compared to congenital erythropoietic porphyria, because in previous case we have seen coproporphyrin 1, uroporphyrin 1 and protoporphyrin 1 all are increased, but here only uroporphyrinogen 3 get accumulated, and when this uroporphyrinogen 3 get accumulated, it inhibits the enzyme, third enzyme, that is uroporphyrinogen 3 co-synthase, which leads to decrease in the concentration of uroporphyrinogen 3. Hence the disease is less severe. Next disease is hereditary coproporphyria. It is also a autosomal dominant disease. The enzyme deficiency is coproporphyrinogen oxidase. Now this coproporphyrinogen oxidase oxidizes the coproporphyrinogen 3 into protoporphyrinogen 3. In this case, NADP acts as a coenzyme which accept 2 hydrogen atoms and they get reduced to NADPH. Carbon dioxide is removed, or carbon atom is removed in the form of carbon dioxide. Again, photosensitivity is seen. In this case, coproporphyrinogen 3 is accumulated. This is the fifth enzyme, CpG oxidase, which converts CpG into PpG. So CpG get accumulated. CpG 3, photosensitivity is seen, but it is mild. Urine is colored due to excretion of uroporphyrins and coproporphyrins in the urine. Next is hereditary protoporphyria. It is a autosomal dominant trait. Enzyme deficiency is heme synthase or ferrochelatase, which is the seventh enzyme of heme synthesis pathway. This enzyme converts the protoporphyrin 3 into heme by inducting the ferrous iron inside that tetrapyrrole ring. Here protoporphyrin 3 is increased in plasma and RBCs, but it is not excreted into the urine. Therefore, urine is having normal color. So this is about the congenital porphyrias and acquired porphyrias. I have already explained you. Acquired porphyria means the porphyrias seen after birth. It may be due to lead poisoning or heavy metal poisoning, which inhibits the enzymes of various enzymes of heme biosynthesis pathway. Chronic renal failure, malignancy, liver diseases, which hampers the heme synthesis pathway. Iron deficiency, again iron is required for the last step. So when iron is deficient, heme synthesis does not occur properly. It is also called as acquired porphyria. Alcoholism, alcohol inhibit the enzyme, coenzyme pyridoxal phosphate, which is required for the action of ALA synthase, which is the rate limiting enzyme of this pathway. ALA synthase is the first enzyme. Coenzyme for this is pyridoxal phosphate. Alcohol inhibit that pyridoxal phosphate, so ALA synthase does not work properly, and hence the whole pathway is inhibited. Alcoholism. So this is about the disorders of heme biosynthesis, that is porphyrias. Thank you very much.